The African meningitis belt is an area that extends from Senegal to Ethiopia, suffering from hyperendemicity of meningitis as well as seasonal meningitis epidemics. Due to the public health impact of this disease on the population, it is critical to perform a lumbar puncture whenever bacterial meningitis is suspected, and if possible, before antibiotic treatment is started. This is the only way to confirm the diagnosis in order to decide the most appropriate treatment of the patient, and as well to facilitate community health decision-making, including the most appropriate vaccine for mass immunization during the epidemic season. The prime purpose of this film is to train health clinic staff on how to perform a safe lumbar puncture and how to handle spinal fluid specimens appropriately. A lumbar puncture is an invasive method, and thus it is very important that it be performed properly. If not, it could endanger the patient's life and produce a bad specimen that would make successful lab testing impossible. It is also a waste of precious time and resources. The lumbar puncture kit was developed to assist you in this task. It makes it possible to perform a lumbar puncture safely and enables medical staff throughout your region to quickly identify the agents responsible for meningitis. The kit is used to aid in patient diagnosis and treatment, as well as to obtain organisms for a possible vaccination decision, while protecting the patient's life. In this film, we will look at the lumbar puncture kit in detail, including its components and their use, and we will learn how to perform a lumbar puncture. We will see all the components of the kit individually. We will learn what they are for. We will see when to use them. In the case of meningitis, a lumbar puncture is performed to extract spinal fluid in order to identify the responsible agent of the disease. The procedure, which only takes 5 minutes to perform, actually requires several key steps to obtain good results. The kit, which will be supplied to health centers by the Ministry of Health, contains everything you need to perform a successful lumbar puncture. It consists of many parts and was born out of necessity to situations that occur often in the field. Let's look at its contents in detail. 2 lumbar puncture needles. 2 sterile tubes. 2 alcohol swabs. 2 sterile gauze pads. 2 Band-Aids. Latex gloves. Iodine. 10 adhesive labels. But just having the kit is not enough. It is important that the procedure is performed properly. Let's look at the steps involved in a successful lumbar puncture. Be sure to wash your hands before starting. Always wear sterile gloves. Explain to the patient's relatives the procedure you're about to perform. Place the patient on his side, with his back on the edge of the bed and with the knees flexed. Thoroughly disinfect the puncture site. Locate the space between L4-5 or L3-4 vertebrae. This space is situated in the plane of the iliac crests. Using the spinal needle, collect between 1 to 3 milliliters of spinal fluid, CSF. After taking the sample, Cover the puncture site with a dressing and allow the patient to lie flat for at least 30 minutes. CSF is normally crystalline. A milky tap is characteristic of a bacterial meningitis and indicates that the patient requires immediate treatment. Always complete the paperwork. This includes labeling the tube and completing the case report and the laboratory request. Be sure that the identification number is the same as the one on the label. Make a copy of the forms before sending them to the laboratory. Once the sample is obtained, it should be examined to determine the presence of bacteria. This is achieved first by direct microscopic examination and then by a gram stain. Even a fairly basic lab should be able to carry out a gram stain test. It is an important test and will tell us what type of bacteria, Meningococcus, Streptococcus, Haemophilus, we are dealing with, and allow doctors to quickly start proper treatment. During the epidemic season, meningococcal meningitis is predominant. However, it is important to perform supplementary analysis to determine to what serogroup the meningococcus belongs to. The identification of the serogroup can be done immediately with a latex test if available. In any case, and as often as possible, the samples should be sent to a reference lab for confirmation by culture. To preserve the sample and increase the chances of identifying the germ, transport needs to be done following strict procedures. It is vital that the sample arrives at the lab rapidly and in good condition. For transport to reference labs, you must use a trans-isolate medium, a substance that allows the sample to last for days after being taken from the patient. TI bottles should be maintained in a fridge and be removed at least 30 minutes before use. After you have collected the CSF, disinfect the top of a TI medium vial with alcohol and allow to dry. With a new sterile needle and syringe, transfer 1 milliliter from the sterile tube into the TI bottle. If the specimen cannot be transported immediately, the TI bottle must be ventilated to ensure bacteria growth. To do so, clean the top of the bottle with alcohol. Using a new sterile needle, puncture the rubber cap. After this is done, use cotton wool to act as a filter for air getting to the specimen. Keep the sample at room temperature, away from light and cold. Meningitis bacteria are very fragile, so transport should be undertaken as quickly as possible and within 72 hours. Before the bottle is packed for travel, remove the needle. These procedures will enable travel to a reference lab a distance away while still producing good lab results. For transport, use a triple packaging system if available. Be sure to include the paperwork. Beware of national regulations for packaging and transporting specimens collected during outbreak investigations. Transport to the reference lab as soon as possible. The culture test that is usually done at a reference lab at central levels allow medical health staff to monitor trends of the strain, as well as to determine the antibiotic sensitivity. If you follow these steps, you will do a better job and produce first-class results. Let's sum up what we've seen. Remember that a lumbar puncture is an invasive procedure. The material provided in the kit will allow you to perform a lumbar puncture in aseptic conditions. Once the CSF fluid sample is taken, be sure a direct microscopy and a gram stain are always performed. If transporting, remove the TI bottle from the fridge at least 30 minutes before use. Ventilate if necessary. Complete the paperwork. Use proper packaging methods. If you follow these steps, you will be saving time, resources, and lives.